Saya Nur Rizwan, audiologis daripada Best Hearing Aid Center Kelang selaku host pada hari ini. Jadi, topik apakah yang akan kita bincangkan pada hari ini? Seperti yang kita sedia maklum, 4 Februari setiap tahun merupakan Hari Kanser Sedunia. Hari Kanser Sedunia adalah inisiatif dari Union for International Cancer Control UICC, merupakan organisasi barah antarabangsa yang terbesar dan tertua. Ia dilancarkan pada 4 Februari 2000. Kanser merupakan salah satu penyakit kronik yang kerap berlaku dan boleh menyerang sesiapa tanpa mengira umur, jantina dan juga bangsa. Menurut Pertubuhan Kesihatan Sedunia WHO, kanser merupakan penyebab kematian kedua paling tinggi di dunia, iaitu kira-kira 1 daripada 6 kematian yang berlaku adalah punca daripada kanser. Sejak 2 dekad yang lalu, kanser adalah salah satu dari 5 penyebab utama kematian yang berlaku di hospital-hospital kerajaan dan juga swasta. Jadi, bersama-sama dengan saya untuk membincangkan topik pada hari ini, saya menjemput khas audiologis daripada Sarawak. Kita ada Mr. Elvin Cho daripada Best Hearing Aid Miri dan juga Miss Syamimi daripada Best Hearing Aid Kuching.
Hi everyone.
Hi.
Hi everyone.
Hi, saya Syamimi from Kuching.
Hi, I'm Elvin from Miri, Sarawak.
So Elvin, can you tell us more about ear-related cancer?
Okay, definitely. So before I explain what is ear cancer, we first have to understand how our ear structure is and also how we actually hear sound. Okay, with me here, I have a model of the ear. All right. So sound is actually vibration of air particles. So in order for us to actually hear this sound, we have to make sure that these vibrating air particles travel across different parts of our ears. Right, so the first part of our ears is actually the outer ear. So we have our pinna and also our ear canal. So the function of this is to actually collect sounds from the surrounding and then direct it towards our eardrum. As you can see here, that's our eardrum. Okay, so behind our eardrum is actually an empty cavity. So if I just remove the eardrum, so it's actually an empty cavity. Right, so in this is what we call our middle ear. So in our middle ear, there are actually 3 tiny bones known as the ossicles. So the ossicles function is actually to deliver the sound from outer ear into our inner ear. So in our inner ear, if I just bring this closer, okay, you can see here, there's 2 structure over here. So this is our semicircular canal, which is responsible for our balance system. And then we have our snail-looking like structure here, which is our cochlea. So in cochlea, there are many hair cells that are responsible to send signal to our brain. So as I mentioned previously, sound is actually vibration of air particles. So it travels across these different parts of the ear and then reaches the hair cells. So when the hair cells vibrate, it will then send signal to our brain. So this is how we actually hear. Okay, so we're done with that. Okay, so next we talk about ear cancer. Ear cancer is actually a very rare type of cancer. Okay, so it usually starts from the outer part of the ear, especially on the surface of our pinna and also the surface of our ear canal. This is typically a skin cancer. And also other type of cancer that affects ear are actually the one that affects our gland. So they are these wax excreting gland. So you find that you have earwax in your ear. So these are the gland that produce them. So cancer might affect them as well. And also there are cancer that affect our salivary gland. So when it affects our salivary gland, although it is not in our ear, it may grow and eventually move towards our inner ear, towards our hair cells here. We grow. Same goes to the outer ear cancer, the skin cancer, and also the middle ear cancer. It will eventually grow inwards towards our cochlea. And this is what causes our hearing loss.
Oh, okay. So menurut Mr. Elvin tadi, kanser telinga ni memang sangat jarang lah berbanding dengan kanser-kanser yang lain. Dan kebiasaannya ia bermula sebagai kanser kulit pada bahagian telinga luar. Jika tidak dirawat dengan awal, ia akan terus berkembang ke salur telinga dan juga kita punya saraf facial lah. Dan kanser telinga juga berkembang pada kelenjar yang menghasilkan kita punya tahi telinga ataupun juga air liur, kan? So what are the symptoms of ear cancer?
Okay, so as I mentioned previously, there are cancers that affect the outer ear and also the middle and the inner ear. So for the outer ear cancer, the symptoms are actually quite typical of a skin cancer. So you might find sores or spots they are inflamed and they can last for more than 4 weeks. Okay, and also if you have mole on your ear, let's say if you have a mole on your ear, if there are any changes such as growth or maybe itchiness, or maybe if the mole starts to discharge fluid, so these are also signs of ear cancer. Right? For the inner part of the ear, the cancer are usually harder to diagnose due to their symptoms. So their symptoms are quite typical of any other ear diseases as well, such as sudden hearing loss, or you might feel a tingling sensation on your face, or maybe even you feel pain in your ear. But one thing that we must pay attention to is actually the discharge of fluid from our ear. So if there's a discharge, especially if it's blood, then it is a big sign of ear cancer.
So what can cause ear cancer?
So ear cancer, as it is very rare, there are not a definite list of risk factors that we can actually tick off from. So we know that skin cancer can happen on the ear. So a typical cause of a skin cancer is actually too much exposure to the sun. So next time, if you go to the beach, and Mimi, if you go to the beach, remember, if you apply sunscreen, remember to apply it on your ear as well.
Oh, okay.
Okay, I see. So that means that the causes of ear cancer ni disebabkan oleh sun jugalah kan, matahari. So mana-mana dekat luar nanti jangan lupa pakai sunscreen
Ya, betul. Jangan lupa telinga.
Saya just simplify balik lah sign dan simptom yang biasanya kita jumpa dekat patient yang ada ear cancer ni. So usually yang the first one adalah ada tompok-tompok radang lah dekat bahagian kulit ataupun bahagian telinga. And then the second one adalah apabila perasan ada bentuk tahi lalat ke apa yang mana tumbuh tu dia tumbuh yang secara tidak normal lah daripada tahi lalat yang biasa. And then sometimes patient juga akan rasa sakit telinga, sakit dalam kawasan telinga, and then rasa kurang dengar, and then dia juga ada rasa macam sikit pening ke, rasa tak stable, yang mana affect dia punya dizziness. And then sometimes ada jugalah patient yang dia rasa sekebas bahagian satu muka sahaja, and then dia akan nampak bengkak pada kelenjar leher limfa dia. So usually walaupun dia punya causes tu masih unknown, tapi bila let's say macam patient tu dia nampak simptom-simptom tu, it's better untuk pergi seek jumpa doktor ke apa ke. And then let's say bila macam patient tu dia dah dia dah ada cancer tapi tiba dia ada hearing loss. And then patient datang jumpa kita, dia tanya, kenapa saya ada hearing loss tapi saya sedangkan yang saya ada tu adalah cancer. So macam mana benda ni terjadi?
Okay, so yes, regarding your question, Mimi. So unfortunately, most of the time, hearing loss that cancer patient experience is not due to the cancer itself, but instead it is actually caused by the treatment regime of the cancer treatment. For example, chemotherapy. So you have people who come in with, let's say, lung cancer, all right? Coming to our center, they have lung cancer, and then they say that they are experiencing hearing loss. Why is that so? It is because of their chemotherapy drugs. Yeah, so I hope that answers your question.
Okay, then why do doctors still prescribe the treatment although it is damaging our ear?
Okay, so currently chemotherapy is considered a gold standard in cancer treatment because it is relatively effective compared to other treatment. Right? So, and yes, unfortunately, it will damage our hearing, but the pros of the treatment often outweighs its con. So imagine, okay, Mimi and Izwan, let me ask you, imagine you are a doctor and a patient comes in to you with a lung cancer, let's say, and then would you choose to cure his cancer, or would you choose to save his hearing but then keep the cancer? Which one will you choose?
Choose cancer lah, dia life threatening.
Yes, definitely you will choose to cure the cancer, although it has many side effects.
Yes.
You can see that chemotherapy has a lot of side effects, not just towards our hearing, but also towards other parts of our body. But still, doctor prescribe them because it is one of the more effective way to treat cancer.
Okay. So kesimpulannya ni kita kena pilih lah antara nak pulihkan barah ke ataupun nak selamatkan pendengaran. Which is priority kita of course lah kita nak selamatkan barah sebab nak save kita punya life juga kan, daripada selamatkan kita punya pendengaran. Okay. So how do these chemotherapy drugs damage your ear?
So there are so many types of chemotherapy drugs out there, but the two chemotherapy drugs that I want to mention are actually cisplatin and carboplatin. So they are actually metal based. Specifically, they are made out of platinum. So platinum, imagine yourself injecting platinum into your body. It is definitely going to have a lot of consequences. So in our case, these platinum-based drugs actually damages our hearing nerves, which is present in our inner ear. All right. So the hearing nerve and also the hair cells. So when this happens, when the damage is done, less signal will be sent to our brain, and this will then result in hearing loss because less signal sent to your brain. Then the sound is supposed to be 100% volume, but when it reaches your brain, it is perhaps 70%. So that is why people will experience hearing loss. And also one more thing that I want to mention is the damage that is caused by chemotherapy drugs are usually affect your high-pitched hearing. So high-pitched hearings, or why is this important is because high-pitched sounds plays a very important role in our daily conversation. So high-pitched sounds such as or these sounds are usually in the beginning or the end of the words. So if you cannot hear these words, you are actually sacrificing the clarity of the speech. So you find that if you have hearing loss in the high-pitched region, you find that other people are actually mumbling. They don't sound very clear. So this is one of the few complaints that we get a lot in our clinic.
Okay, so maksudnya dari sini pengambilan ubat-ubat kemoterapi ni juga akan menyebabkan kerosakan pada saraf telinga kita lah, dan seterusnya menyebabkan kita ada masalah pendengaran. Dan biasanya akan efek kita punya pada frekuensi yang tinggi, dan seterusnya menyebabkan ketidakjelasan pada bunyi pertuturan, yang maksudnya kita tak akan dengar dengan jelas lah bunyi pertuturan orang kan. So what are some of the common signs that I am experiencing hearing loss from chemotherapy?
Okay, commonly the first sign of chemotherapy damaging your inner ear, very typical of a hearing loss, is actually the presence of ringing sounds. So some people might find it a high-pitched ringing sound, some people might find it low-pitched ringing sound. So it is based on individual. So these ringing in your ears will then eventually followed by a gradual hearing loss. So how do you know if you have gradual hearing loss? So you will find that you will have difficulties having conversation, especially in a very noisy environment. Okay? And also, you might get tired more easily. Just after a few conversations, maybe let's say Mimi used to be able to do 3 hours conversation, no problem. But now, after 30 minutes of conversation, she gets tired and just want to go back home. So this is one of the signs that you have hearing loss.
Okay, so basically yang common signs yang ada bila someone tu ada masalah pendengaran tu, dia akan dengar bunyi berdesing dalam telinga lah. And then the second one is dia akan rasa kurang dengar bila bercakap berbanding dengan yang normal dulu. And then bila dia start ikut ke perbualan tu, dia akan rasa macam dia tak jelas, perbualan tu tak jelas, tak clear, tak terang. And then sometimes ada jugalah yang akan minta repeat apa yang orang tu cakap. So And then dia ada juga lah tendensi yang kita speaker tu akan rasa macam stress ke apa, so yang tu kita nak avoid lah. And then ada juga untuk sesetengah patient tu dia akan tense untuk cakap dengan suara yang kuat sebab dia sendiri tak dengar apa yang dia cakap, so sebab tu dia akan sedikit menjerit lah. So yang tu dia membuatkan orang sekeliling tak selesa. So kalau boleh kita nak avoid yang tu, elakkan daripada terjadi dekat community lah yang ada masalah pendengaran. But then Alvin, actually kalau let's say lah patient tu dia dah fit lah, kira dia dah ada semua kriteria tu, sepatutnya dia kena jumpa siapa dululah, doktor ke, audiologist ke, yang mana dulu untuk rawat dia punya masalah.
Okay. Regarding your question, so let's say if you are still undergoing the treatment, definitely consult your doctor to see if there are any other alternative chemotherapy drugs, let's say. And also make sure that you constantly attend your hearing test with your audiologist, because people who are undergoing chemotherapy will often have hearing tests at the same time. The reason for this is because the audiologist will want to monitor your hearing at the higher pitch level, especially. And also another advice that I would actually give to people is actually to avoid caffeine, alcohol, and cigarettes. Why? Because these three are one of the few of the most damaging substance for your ear. It may speed up the damage to your ear. Let's put it that way. It may speed up the damage to your ear.
I see. So for how long, macam berapa lama dia kena avoid yang tiga tu lah, caffeine, alcohol ataupun smoking, merokok.
Okay, avoiding, well, some people can stop cigarette, alcohol and coffee easily, but some people love their coffee. For example, Izwan suka kopi kan? So try to avoid drinking coffee. I mean, reduce your coffee consumption, maybe from 3 cups a day to maybe 1 cup a day. So the reason why is because these three substances may increase blood flow to your ear. So the more blood flow going into your ear, this will cause the symptoms of hearing loss to become worse.
Okay.
So it depends on you. If you want to drink coffee, go ahead. If you want to smoke, go ahead. But then do it moderately. But definitely try to avoid. But definitely reducing your alcohol consumption and cigarette definitely is going to be beneficial for your health. But still, it depends on you.
Nice. So basically kena kurangkan lah, kalau nanti terus stop kan jadi lain pula.
Macam Izwan marah-marah nanti.
Itulah. So and then let's say lepas dia jumpa doktor dengan audiologist tu untuk cure dia punya masalah, basically pendengaran tu dia akan back to normal ataupun dia tetap akan ada loss ataupun makin teruk ke, macam mana?
Okay, depending on what kind of cancer treatment that the patient is having, because unfortunately, damage caused by chemotherapy is usually permanent and irreversible because they affect our hair cells and our hearing nerves. So the only thing that we can actually do is to monitor and preserve whatever hearing that we have. Okay? So another option of cancer treatment is actually surgery. So surgery is also quite common. Okay? This may also disrupt how our ear directs sound. For example, let's say nasopharyngeal cancer. So nasopharyngeal cancer is actually cancer which is located behind our nose. Okay? So surgery is one of the options to remove the cancer cells. So when the surgery is done, it may cause the swelling in this tube that is connecting our nose and ear. Okay? So it may cause swelling. So what happens is you might feel that your ears are blocked. It is just like when Mimi goes to travel with her family in a plane, and then suddenly she feels like, oh, why do my ears feel so blocked in the plane? And then I cannot hear that well anymore. So this is the similar symptom to people who have swelling in the eustachian tube. But worry not, usually swelling of the eustachian tube will eventually subside. So when that subsides, your hearing usually goes back to normal.
So actually dia depends lah kan dengan apa treatment, dengan apa cancer yang dia dapat lah. So basically memang kena keep on follow up lah dengan doktor ke audiologist. So macam at least boleh monitor pendengaran tu macam mana lah kan.
Betul.
Okay, so how can we preserve our residual hearing after chemotherapy?
Okay, one way to preserve our residual hearing after chemotherapy, okay, although very cliche, is to avoid loud sounds. Okay, not only loud sounds, but loud sounds over a long period of time. So no more listening to music using your earphone for the whole day, no more going to music festival that could last for the whole day, or even going to gun range. All these are actually quite bad for your ear. And another way to preserve our residual hearing is actually to consider getting hearing aids. So hearing aids help to preserve our hearing by keeping the nerves stimulated. So it keeps the nerve working. So it is just like our muscle, all right? Muscle. So let's say if you don't use it, eventually it will become weak, right? Same as a hearing nerve, if you don't use it, eventually it will deteriorate. So it will become worse, okay? However, the difference between these two is, if your muscle become weak, what do? Eat good food, go to the gym. Problem solved. You get strong again, like Izwan. And then let's say if your hearing nerve is damaged, there is no turning back. The damage is usually permanent because it involves our nerve. So hearing aids keep your nerves working so that you can maintain your hearing. And also, I said previously, reduce caffeine, alcohol, and cigarette.
Okay. So kat sini kita memang perlu jaga betul-betul lah once kita dah ada hearing loss tu because of the chemotherapy tu, and of course kita kena jagalah supaya pendengaran kita tak makin lagi teruk. Jadi of course kita kena avoid tempat-tempat yang bising, loud sound pun semua. So tak boleh sangatlah pakai earphone tu kalau nak dengar muzik semua kan. And then macam tadilah, kena kurangkan pengambilan kafein, alkohol dan juga sigaret. Macam saya memang coffee lover lah. So setiap pagi wajib ada kopi.
Nanti tu takut ada masalah pendengaran.
Itulah, kena kurangkan sikit lah.
Itulah. So basically macam lepas kita discuss tadi yang ubat-ubat untuk chemo, which is cytoplastin dengan carboplastin, usually memang ubat tu akan affect masalah pendengaran lah, akan lead kepada masalah pendengaran. Tapi basically ada tak macam ubat-ubat yang selain daripada untuk chemo tu yang akan menyebabkan someone tu ada masalah pendengaran lah?
Definitely. Okay, so these kind of medication are called ototoxic medication. So it means drugs that are harmful to your ears. So certain antibiotics and also anti-inflammatory drugs, those two examples, are also a few of the most common culprit of hearing loss. Okay, so it is, let's say if you are worried if your medication is ototoxic or not, you can actually go to your doctor and consult them and ask, okay, is my medication ototoxic or bad for my ears? So if it is there any other alternative to this medication? You can always ask your doctor for it, or maybe you can consult your audiologist as well.
So basically memang each time dapat ubat, better tanyalah sebelum nanti tak ada confusion lah, tak ada confuse sama ada ubat ni boleh masalah ini ke, masalah itu ke. And then let's say bila someone tu dah start ada masalah pendengaran, apa dia kesan dalam dia punya life lah, kehidupan harian dia tu, implication dia?
Okay, so hearing loss generally affect a person in 3 ways, I would say. 3 ways. So those people with hearing loss usually will have fewer educational and job opportunities due to their impaired communication. For example, let's say if a person who has hearing loss is working at a place which requires effective communication, for example, a banker. So a banker needs to call their clients every day, need to have discussion with their client every day. So if they have hearing loss, they're actually running a risk of losing their job. Let's say if they mess up their work somehow due to their hearing loss. And another example is actually, let's say if it is a student with hearing loss. If they are in a class, they are missing out what the teachers are saying. They are also going to miss out a lot of information, okay, and might have lower educational achievement. So which in turn will result in fewer job opportunities. Okay, so that's the first implication. So the second implication is that some people might experience social withdrawal symptoms. All right, so they might find themselves trying to avoid situation where they have to talk to people. They'd rather stay at home. But the thing is, humans are actually creatures of socializing. So we need to interact with others in order to keep our mental health healthy. So we can see, like, for example, during this COVID-19 pandemic season, right? We can see many people who are depressed, who are actually feeling lonely, and then there's a lot of mental health issues that arises due to the isolation of them from others. Okay? And then lastly, tying to my second point, hearing loss may cause someone to have emotional problems, mainly due to their low self-esteem and confidence. And they might feel embarrassed because they are missing a lot of what others are saying, and also at the same time feel as if people are avoiding them. People are avoiding to talk to them because it does require a lot of patience and strategies to communicate with those who has hearing loss. And not everyone has the awareness of the strategies, and also not everyone has the patience to communicate with people with hearing loss. So these are the three main reasons, three main effects of hearing loss.
Okay. So biasalah bila cancer patient ni, once dia dah ada cancer, lepas tu ada pula hearing loss kan. So of course sedikit sebanyak akan effect dia punya life dah juga especially dari segi dia punya emosi apa semua. And then bila ada hearing loss dengan cancer ni, of course dia akan rasa diri dia macam tersisih ke, ataupun dia rasa rendah diri dan tidak confident dengan dia punya life. Okay. So do you have any last advice for the people out there regarding ear cancer?
Yeah, so although ear cancer is very rare, but definitely whenever you are experiencing symptoms such as sudden hearing loss, or maybe facial numbness in one side of the face, or maybe ear pain, so I would usually recommend you to immediately visit your ENT or doctor. Right? Because the reason why I want to tell this to everyone is because most of the time people always comes into our center and then they complain they have sudden hearing loss, but the hearing loss has happened months and months back. The thing about hearing loss treatment is actually we base a lot of our treatment on the concept of prevention is better than cure. So whenever you have sudden hearing loss, go to your doctor. Do not take lightly of the situation. So those are my final words.
Okay, Miss Syamimi ada apa-apa nak explain lagi ke?
Okay, tambahan daripada saya, kalau dah start experience macam Elvin cakap lah, kalau you terus rasa sudden loss tu better pergi seek ENT. But then kalau dah rasa kurang dengar, rasa susah nak bercakap, rasa susah nak follow orang cakap, it's better terus jumpa audiologist ke, booking and then check whether dah teruk ke apa ke tak, so that kita akan settle for another management lah untuk patient.
Okay. So Elvin, I think that's all from my side. So kita tunggu kalau ada soalan daripada penonton kita lah. Tengah ada soalan tak daripada peminat ke, penonton ke? Okay. Okay. So rasanya okay lah. So rasanya juga hari apa ni? So hopefully info yang diberi oleh Miss Syamimi dan juga Mr. Elvin ni dapat membantu kita semualah. Okay. Okay, kita ada soalan daripada Cik Sharifah. Pendengaran boleh makin teruk ke kalau kita pakai alat?
Mimi nak jawab ke? Nak saya jawab?
Jawab dululah.
Okay, so it depends. It depends, all right? So if you are wearing alat that you buy from, let's say, AliExpress or something, or from China, those cheap alat, then definitely you are going to damage your hearing because those are not fit based on your hearing loss. So everything is loud. It's basically like taking a speaker and put it on your ear. You don't adjust it. But instead with our hearing aids, we are actually adjusting it based on your hearing loss using our computer and software. So we as an audiologist, we have to make sure that it fits your hearing loss and does not further damage your hearing. So my answer to that will be no, most of the time. If the alat is fit properly, then no, it won't have any major damage to your hearing.
Okay, we have a question from Mr. Elvin from Daphne Ko. Can I know how do you deal with patients with hearing loss normally?
So people with hearing loss, if we are talking about people who come into our center, definitely we're gonna do hearing tests first to see where the hearing level is at. And then if the hearing loss is affecting the quality of life of that patient, definitely we are going to prescribe hearing aid. So that is usually how we do it. So we do tests first, and then we prescribe rehab for rehabilitation purposes. So hearing aid is actually a very good tool for the patient it's a very good treatment option for the patient.
Okay.
I hope they answer your question, Daphne.
Okay, another question from Gwendolyn Chu. Do hearing aid restore your hearing to normal?
Unfortunately, okay. Maybe you want?
No, okay. So basically bila someone tu been fitted by hearing aids, dia tak akan restore to normal hearing lah, but then dia boleh membantu untuk someone tu dengar lebih baik. Macam tu saja. Dia tak ada macam back to normal ke hearing level, so far tak ada lah. Memang kita so far tak ada treatment yang untuk once you dah ada masalah pendengaran yang kekal tu, especially memang tak akan back to normal lah. So alat ni dia akan membantu you untuk mendengar dengan lebih baik.
Betul.
Hopefully in the future there will be medication for hearing loss. Hopefully.
Yeah. Yes.
So usually once we have a hearing loss too, of course they cannot go back to normal again lah. Okay. So because the hearing aid ni dia punya fungsi dia tu untuk amplify the sound, untuk bantu kita balik nak mendengar bunyi-bunyi yang kita dah miss out before this. So untuk balik kepada normal tu maybe difficult lah. Mungkin jarang lah untuk back to normal.
Yes.
Okay, kita ada lagi soalan daripada Nurul Syahida. Does all cancer can lead to hearing loss?
Very good question. No. I mean, not as I mentioned previously, cancer itself does not cause hearing loss if it doesn't affect our ear. Okay, let's say if there's the skin cancer, it may cause hearing loss because it grows towards our inner ear where our hair cells at. But let's say if it's lung cancer, and usually it won't, because if it is localized cancer, then it won't affect our ear. But the treatment itself, the chemotherapy, might most of the time will damage our hearing, which then leads to hearing loss.
Okay.
Yeah. So the short answer to that is no.
Okay. So another question from Shazana Nur Farahin. How to convince patients to wear hearing aids because they already endure with their pain?
Yes, we understand. We as an audiologist should understand because chemotherapy or any cancer treatment is not easy. It's very tricky, and most patients will feel like they don't care about anything else. So we as an audiologist, we usually won't force it on them. But let's say if it is affecting their quality of life, All right, if they are affecting the quality of life, then we have to slowly counsel them. Because wearing hearing aids is not like wearing glasses, but even wearing glasses, you need time to get used to it. Same as hearing aids, you need time to get used to it. So definitely, it depends on the choice of your patient. Right. So if they want to wear hearing aids, it's their choice. If they don't want to wear hearing aid, it's also their choice. But definitely, as an audiologist, we will advise them to wear hearing aids because it definitely makes a difference in their quality of life.
So untuk soalan ni, untuk kita convince patient tu, not kita sebagai audiologist saja yang kena convincekan pada patient tu lah. Maksudnya orang sekeliling, ahli keluarga juga memainkan peranan penting untuk convincekan patient yang ada hearing loss ni untuk pakai hearing aids. Okay, sebab macam audiologist, of course kita boleh explain kat dia how important the hearing aids, but orang sekeliling kita, orang sekeliling patient tu sendiri yang memainkan peranan lebih penting untuk memujuk patient ni untuk pakai hearing aids.
True.
Okay.
So basically support from family semua lah.
Yeah. So soalan kita ada Sakinah Soleh. For unilateral hearing loss, is it compulsory to wear hearing aid? So siapa? Cik Mimi boleh jawab ke?
Cik Mimi boleh jawab.
So basically bila kita dah check telinga seorang tu and then dia dapat unilateral hearing loss, it's better untuk pakai alat lah. Sebabnya salah satu adalah dari segi localization, maknanya daripada mana bunyi tu kita daripada sumber bunyi tu ada lah. Okay. And then sometimes walaupun dia dah biasa dengar satu belah, kita punya brain processing ni dia akan proses from dua-dua belah telinga lah. So basically bila dah fitted dengan dua-dua belah, dengan satu belah yang affected tu, so dia akan membantu processing tu lagi cepat, macam lagi mudah, and then in term of understanding speech pun lagi better. And then kalau let's say tengah shock bawa motor ke basikal ke, kalau you ada one side loss, maybe you tak tahu sumber bunyi bising tu daripada mana, which is sometimes membahayakan keselamatan jugalah.
Betul.
So I think another question, can I check my hearing at home or do I have to visit audiologist? So
generally it is best to visit your audiologist to check your hearing because we have a machine that is calibrated every year. So it is based on it is calibrated accurately. So if you do test at your home using your, let's say, use your phone or with your earphone, you do hearing test. Yes, it is possible to be done, but it is not as accurate as the test that will be done by your audiologist. So definitely go to your audiologist.
Yeah, betul. More accurate lah if you go visit to our audiologist kan. Sebab we use the specific punya headphone untuk kita test kita punya hearing. Okay. So another question is, may I know there are how many stages of hearing loss? So dia nak tahu berapa level hearing loss ni yang kita ada sebenarnya.
Level of hearing loss.
Yes.
If we talk hearing loss, actually it varies depending on people, all right? But in general, in our audiology field, we actually classify our hearing based on the severity of hearing loss. So unlike most people always say, oh, I got percentage, this percent, 50% hearing, 60% hearing. So it doesn't work that way. We actually classify it based on where your hearing is at. So that could be mild, it could be moderate, severe, or even profound. So that is actually how we classify hearing loss. But the stages of hearing loss, for example, like you might find it more difficult to communicate with others, but it is very subjective. So there is not a definite stage to determine the stage of hearing loss. Hope that answers your question. Anything want to tambah?
Betul. So it depends on level lah, bukan stages. Level of hearing loss.
I think kita ada rasa ni maybe last question lah kot daripada Amirah Shahana. How about cross hearing aid for unilateral hearing loss?
So, for me? Okay. So cross hearing aid, it is the best treatment at the moment for unilateral hearing loss, because it depends as well, depending on how serious your unilateral hearing loss is. Let's say if your one side of the ear is deaf, it's like completely deaf, you cannot hear at all, and hearing aid cannot help. Right? Definitely cross is a good option, because what it does is actually it collects sound from the surrounding. All right. So for example, this is my deaf ear. All right, I cannot hear anything from here. So what it does is it actually collects sound from this side of the ear and then deliver it to my good ear. So this is actually how it works. So it collects the sound from this side and move it to this side. And then by doing so, then you'll be able to capture the sound surrounding you, although all the sound will be on one side. And that is the only disadvantage of cross hearing aid. But it is still good because you'll be able to hear sound. Just like Mimi said just now, if you bawa motor, tiba-tiba you didn't hear someone honk you on this side, the damaged side, the deaf side, then you result in an accident. So with cross hearing aid, it will actually pick up the honk and then it will send it to your better ear, and then you realize, oh, someone is honking me, but I don't know where it is. But at least you can hear the honk that will prevent you from having an accident.
Okay. So I think this one yang the last question. So biar saya jawablah untuk soalan yang last ni ya. Special ni daripada Wilda Mushida. How about hearing aid adjustment? Can adjust it from home? Now is PKP, difficult to go center. Okay, untuk soalan ni kita kena tengok jugalah model alat tu macam mana, sebab sekarang ni nowadays semua brand of hearing aids kita ada sesi macam adjustment from home ataupun online session punya adjust. Cuma patient of course kena ada smartphone lah, and then ada apps yang setiap brand tu semua ada apps dia sendiri. Okay, and then hearing aids tu memang that brand memang boleh untuk buat hearing care anywhere. Okay, jadi untuk patient yang memakai alat hearing aids, alat pendengaran yang macam tu, of course kita boleh buat adjustment dekat maksudnya patient tak perlu datang center, kita just buat adjustment dekat center tapi patient berada dekat rumah dia. So kita seolah macam kita buat online daripada center direct to dia punya hearing aids lah. Tapi not all hearing aids can do that lah, cuma certain alat saja. Dan tapi kebanyakan sekarang semua brand alat memang kita boleh buat adjustment daripada center direct to ke hearing aid. Okay. Okay lah, saya rasa cukup live kita pada hari ini. Thanks to Miss Syamimi dan juga Alvin Chu yang informatif yang sangat berguna. Okay, so kalau ada sebarang pertanyaan lagi, bolehlah follow kita punya Facebook ataupun Instagram untuk tahu lebih update untuk kita punya next event ataupun next topik lah. Okay, sekian, terima kasih daripada kami daripada Best Hearing Aid Center. Bye.
Bye-bye.